Now what I'd like to do is go ahead and move to our next panel. As Ed Hickey talked about, the theme of our overall policy summit is the midpoint in the decade of the kidney in reprioritizing patients across policy, regulatory, and payment decisions. And that's why I'm very pleased that our next panel will start to talk about things about protecting kidney patients and organ donor health, the policy opportunities that are available in 2025. And we're joined by a very distinguished group of individuals who have committed themselves professionally and personally to efforts that are a like cause with AAKP. First, we have Ray Downs. She's a co-founder and partner at Tarplin, Downs and Young, LLC. She's a policy representative for the Partnership to Improve Patient Care, PIPC, which we're a longstanding member of. She has background in the executive branch as a principal deputy assistant secretary for legislation at HHS, and also in the U.S. Senate as a senior staff person. We're also joined by Anna Fedewa, who's the senior manager for government relations at the National Down Syndrome Society, and our good friend Charlotte Woodward, who has a piece of legislation named after her. She's a heart transplant recipient and an absolute spectacular patient advocate who's teaching people who are elected officials and patients alike how to do policy in Washington, D.C. She serves as a program associate at the National Down Syndrome Society. And we have Parker Reynolds, who's an associate at Holland and Knight. She's a policy representative for the Public Access to Sunscreen Coalition, a very important issue for any patient that is immunosuppressed. Ray will go ahead and start talking about the issue of quality-adjusted life years and their impact on innovation in patients. Ray, why don't you go right ahead?
Thank you so much, Paul. Can everyone hear me okay? Yeah, okay, wonderful. First of all, what an esteemed panel. I'm so grateful to be included. So thank you very much for the invitation to participate. As you said, Paul, this is and Christian's presentation was fantastic. What a great tee-off for us to discuss, here on the ground, real-time action in Washington relative to the strength and the power that voters bring to the process. So we're very grateful for the partnership with the folks who advocate on behalf of the kidney community back home. We couldn't do this here in Washington without all the work that happens on the ground back home. In Washington on the ground, maybe that's a good place to start, Paul, in terms of where issues like QALYs and access to innovation stand today. There has been a long-standing effort by this community and like-minded communities to really create an environment of both support and urgency to advance forward better protections and greater access and ultimately greater quality of care and tools and treatments for communities that are dependent on the healthcare system and innovation in the healthcare system. Quality adjusted life years is a term of art that has been around for, I would say now, about 35 or 40 years from a U.S. public policy conversation, but has existed in other parts of the world for a much longer period of time. Its moment is here, thanks to the work that Paul and the community did now back in the early 90s. We have a marker out there that using QALYs, which are essentially a discriminatory metric, when it comes to accessing healthcare, but also when it comes to making decisions about the value of innovations for patients. That was something that was spearheaded by this community to make sure that there was essentially a barrier or prohibition on the use of QALYs and making decisions at the federal policy level, but also in the insurance realm. Now, as we fast forward to this moment in time, the issue of a QALY ban being more expansive and more deliberate and more vociferously put forward by Congress, this is the moment for that, for a couple of reasons. One, because innovation is upon us. We have had a bit of an innovation desert for this community, and we are now in a position to see real potential opportunities for improvements in innovation. But what we cannot have is things like QALY bans or similar discriminatory metrics used to prohibit our ability to create excitement and incentive and ultimately access to new innovation. This is a barrier that needs to be broken down further than it has been already, and now is the moment to do that. The other issue, obviously, is around access through payment mechanisms and limitations like the bundled payment arrangement that really creates, for lack of a better way to say it, a disincentive in investing in and providing access to innovation. So I think there are two opportunities that are very clear, very distilled for this community to be really an important part of advancing forward. And, despite a lot of activity and noise and candidly a lot of partisanship right now, there is opportunity to engage on a bipartisan basis with respect to addressing things like QALYs and making sure that payment mechanisms that limit or hinder access to innovation and care are readdressed. The Trump administration, which obviously has been in place now for about 6 or 7 months, while on the one hand, there has been a degree of disruption and uncertainty that has been brought to the table. On the other hand, that is always an opportunity for communities, back to Christian's point, that are organized and laser-like in their focus and their engagement to take advantage of opportunities. And we saw activity in the first Trump administration that Paul was quite focused on and quite successful at helping to lead, that we can pick up on and advance forward right now. So, and I know we'll get to the others on the panel, so I just want to lay a little bit of the groundwork that now is a moment of opportunity. We have at least two, if not more, specific things we can focus on as a community that we can partner with groups like PIPC and the broad group of additional stakeholders, including some of my fabulous panelists here, to really make progress on broadening the QALY ban and addressing some of the limitations on the bundled payment system. And sort of the mic drop moment is we actually had legislation introduced earlier this week to extend the ban on QALYs. Kat Kamek from Florida, who was actually a former Energy and Commerce Committee staffer, now a representative, is leading the charge and picking up the gauntlet, which we're very grateful for after tremendous leadership from Kathy McMorris-Rogers before she retired at the end of last Congress. So happy to take more questions, but just wanted to sort of put that level set out there as we begin the discussion today.
Thank you very much, Ray. And let me come to you and ask you a question. I think that really kind of boils it down for patients who may be watching and the caregivers that they have with them. And that's this. Quality adjusted life years has been used in Europe and in other countries for a very long time. From a patient perspective, sitting in a chair, can you break it down in the most simplest terms? If a government official is using quality adjusted life years and somebody has multiple conditions, kidney disease and heart disease, what is the essential judgment that that government official is making about that person and their access to a potential life-saving therapy?
It's an excellent question, Paul. And really what happens is these are metrics, they're measurements that essentially place a differential value on a person's life. The healthier you are, the higher the value that they place on your life, and most importantly, the higher the value they place on making an investment in a treatment or care that you might need. If you are a person living with lifelong or chronic or multiple conditions, as Paul said, the score, the value that is placed on your life and the potential for treatments, including innovations in the future, is going to be less. And that's just not okay. And as a country, we have rejected the notion of those sorts of metrics that pick winners and losers and create tremendous access barriers, as we have seen in other countries, particularly relative to new innovation. So that is the conversation that, as we at a larger public policy basis, begin to talk about access issues, begin to explore, where are we making investments in new innovation, particularly for patient communities who have had very limited innovation for a number of years. This notion of, are we going to measure the value of a person's life and the potential treatment through this discriminatory metric, a QALY or a similar measure, or are we going to set those aside, ban the use of those, and instead really look at the true value? Everyone is created equally. Everyone's value proposition from a healthcare and a treatment perspective should be equal, and that is what we want people using as a metric for measuring whether or not they should support innovation and access.
Thank you very much, Ray. You actually just captured, in essence, what all kidney patients go through. Because if you have kidney disease, chances are you have other conditions like heart, metabolic syndromes, and other things like that. I very much appreciate it. America has a proud tradition, and we intend to fight to keep it that way. Which leads me to Anna and our friend Charlotte. Anna, can you talk about some of the work that you've been doing with the National Down Syndrome Society about legislation and access to transplantation? It's such an inspiring story, and I know that you and Charlotte are prepared to talk about that.
Yeah, absolutely. Thank you again so much for having us, the AAKP and everyone here today. Before we transition into a piece of legislation we care a lot about here at NDSS, and I'll turn it over to my colleague Charlotte to start, I just want to underscore too the importance of this QALY legislation. Our president and CEO last Congress was actually called to testify on the legislation that has now been reintroduced, and just really understanding from our patient population perspective the metrics that we know are oftentimes assigned to our community that we know is vibrant and full of life and full of opportunity. And I think that's a theme that carries on into the bill we're going to talk about, but knowing that the healthcare system assigns a number that says something else, and that our community could be denied access to healthcare that they need because, someone who's never met them in a system that doesn't fully understand the value and quality of their life will say otherwise. And so just want to underscore NDSS's support for the QALY ban and that legislation, our continued work to partner and ally with other organizations and communities that feel the same way. So thank you, Ray. And I'll turn it over to Charlotte to introduce herself.
Yes, hi, I'm Charlotte Woodward. I am the Programs Associate at the National Down Syndrome Society.
And I jumped right into it, but I'm Anna Fedewa, and I have the privilege of getting to work with Charlotte at the National Down Syndrome Society. I lead our policy and advocacy efforts on our team.
So at the National Down Syndrome Society, our mission is to empower individuals with Down syndrome and their families by driving policy change, providing resources, engaging with local communities, and shifting public perceptions.
And on the next slide, I'll just really briefly share, I think for Charlotte and I, a big way that we embody that mission is through our advocacy and policy work. So we do policy work at the federal, state, and local level. And I always like to point out that our agenda really spans the life cycle of an individual with Down syndrome. So we do work all the way from prenatal diagnosis to end of life. And I think one of the favorite parts of our work too is the fact that, of course, our focus is on individuals with Down syndrome, but we know the issues we're working on intersect with so many other communities, especially so many other patient populations. And so, again, are just so appreciative of the partnership of AAKP and this understanding that the work we're doing is not just for people with Down syndrome. It impacts kidney patients, it impacts all transplant patients. And we think that's really important and is a great privilege of ours. So I'll turn it over to Charlotte on the next slide to get started on her bill.
So not only was I born with Down syndrome, I was also born with a significant heart condition, which is common in babies with Down syndrome. Approximately 50% have some sort of heart condition. I had 4 open heart surgeries, 3 when I was a baby and 1 when I was 10 years old. As I grew, my heart struggled to support my body. As the struggle worsened, my cardiologist determined that there was nothing more that could be done surgically to help me, and that I was in dire need of a life-saving heart transplant. My cardiologist was concerned that he might face resistance from the transplant team when he presented my case to them, and said that he might have to go to bat for me. Fortunately, my transplant team looked beyond my Down syndrome diagnosis and saw me as a person with inherent value and worth, in need of a life-saving procedure. And on January 30th, 2012, I received a healthy new heart and have been in excellent health ever since. I am very, very grateful for the generosity of my heart donor and to her family, and for the willingness of my transplant team to provide me with the opportunity to receive this life-saving gift. Too often, people with disabilities are denied life-saving organ transplants because of institutional bias, prejudice, and discrimination in the medical field. Against people with intellectual and developmental disabilities and other disability conditions. I am so thankful that my doctors recognize me as someone who is deserving of the same opportunity for a life-saving organ transplant, just like anyone else, and advocated for my right to be considered for a transplant, just like uh, everybody else. When I learned that others were not as fortunate as I was, I became determined to work towards ensuring that right for everyone with Down syndrome and those with other intellectual and developmental disabilities, with the result being that there is now federal legislation before the United States Congress that bears my name, the Charlotte Woodward Organ Transplant Discrimination Prevention Act. I am the third registered lobbyist for Down syndrome in the United States, and I frequently speak with congresspeople and their staff to educate them about my bill and urge them to pass this vital legislation. And I urge you to contact your congresspeople and ask them to do the same. Thank you.
So I have to brag on Charlotte. Not only is she the third registered lobbyist with Down syndrome, but as a result of receiving this life-saving care, Charlotte has gone on to lead an incredibly accomplished and fulfilling life. She has a Bachelor of Science from George Mason University. She works at, I'm sorry, go ahead.
I actually got the Bachelor's of Arts degree.
Oh, Bachelor of Arts. I'm so sorry.
From George Mason University.
I always get the two confused. Who really knows what the difference is, right? I don't know what I have. So Charlotte has a Bachelor of Arts. She has a college degree. She works at NDSS. She sits on the board of like every nonprofit in the state of Virginia because she is just that influential. And so we know that, again, when individuals are given the opportunity, they don't take that gift for granted. So on the next slide, we're going to talk just briefly about, what we know is a problem, and that is discrimination based solely on disability. In 2019, an NCD, National Council on Disability report, found that there is, in fact, systematic discrimination at the provider level, the hospital level. There's categorical exclusions that say people with certain disabilities are just not even considered for transplants, and also a refusal to evaluate transplant teams that say we just don't do that. And unfortunately, here at NDSS, we hear that anecdotal stories from families all the time. A provider looks them in the eyes and says, we just don't do that here, or it would be a waste of an organ. And we know that individuals with disabilities may have medical, provisions for why a transplant wouldn't be a good fit. And of course, we want to make sure that, there's a shortage of organs, right? That people are getting them who are medically suitable to get them. But we also know that in a lot of cases, people with disabilities, their disability does not prevent them from being able to medically accept and provide for an organ, that there's these other influences that are coming into the system. And so we see that on the next slide. In the worst cases, being like baby Zion. So this was a baby born in Florida in 2021 who was born with Down syndrome and a congenital heart defect. He had 5 open heart surgeries in 12 days. It was ultimately determined, and doctors told his family he needs a heart transplant in order to survive, but we don't do that. And for people with Down syndrome. And he was denied that transplant and passed away at just 4 months old. So, Zion's story really just reminded us in our work that why this is important, right? Why this type of discrimination is still continuing to persist and needs to be changed. And Zion is actually, him and his family are constituents of Congresswoman Kamek, who has been a great leader on the QALYs bill and on Charlotte's bill as well. So we'll talk quickly on the next slide. What is Charlotte's bill? I think it's important to always point out this type of discrimination is in fact illegal. It's the first thing people usually say is, wow, we can really legally do that in this country? The answer is no. We have those protections in the ADA, in Section 504 and Section 1557 of the Affordable Care Act. But again, we know it's still happening. So Charlotte's bill really kind of has 2 parts. The first is just, again, re-emphasizing, building off those protections. This really specific form of discrimination is in fact discrimination. But something we think is really important and kind of the teeth of this bill is the fact that it sets up a timely review function at the Office of Civil Rights, or OCR, at the Department of Health and Human Services, HHS. And we think that's really important because we all know oftentimes when you need a transplant, you need it as soon as possible, especially for individuals with Down syndrome, which is largely heart transplants for our population. You need it as quickly as possible. And so you don't have time to go through a court system, to talk to lawyers. You might not have resources or the emotional bandwidth that it takes to go through that process. And so the ability for patients to be able to have a claim come forward at HHS, and then HHS having that really clear directive that they need to resolve those claims in a priority manner, we think is really important. It For our community, they have an increased need for transplants we often see because of that high incidence of heart conditions. But we know for all patient communities that access to care and preventing this type of discrimination saves lives. And I'll turn it over to Charlotte on the next slide to just give you some details on this bill and where it currently stands.
It was in. So my bill was in the House and was being discussed by the House Energy and Commerce Committee, but I'm proud to announce that it is currently out of the House of Representatives as they voted to pass it recently. And I'm also proud to mention that I'm not sure what the date was, but it was introduced recently into the Senate. It is now in the Health, Education, Labor, and Pensions Committee.
That's right. And on the next slide, Charlotte will briefly share who the members leading the bill. You'll notice there's a Republican and a Democrat in both chambers, so it is staunchly bipartisan.
And so when the bill was going through, and so when my bill was going through the House and again worked on and everything, the lead sponsors there were Representative Debbie Dingell, a Democrat from Michigan, and Representative Kat Cammack, a Republican from Florida. Now that my bill is out of the House of Representatives, it is now being taken up by two wonderful lead sponsors in the Senate, and they are Senator Ashley Moody, a Republican from Florida, and the other one is Senator Maggie Hassan, a Democrat from New Hampshire.
And on the next slide, Charlotte kind of already shared, but the biggest update we have on the bill is...
Yes, Anna, you're right. The recent update is that my bill, the Woodward Organ Transplant Discrimination Prevention Act, has already been voted on and passed by the full House of Representatives.
Yeah, on the next slide, we have some pictures just literally earlier this week. We had already finished these slides and sent them over, and I had to email and say, we need to update our slides. Because on Monday, we got a call from Congresswoman Cammack's office, and she said, can Charlotte get to the House floor in the next hour? And Charlotte and I were sitting next to each other eating lunch, and I said, we're going to have to get this to go. You got to go to the House floor. So Charlotte was up in the House gallery and watched as her bill was voted on, debated, and passed by the House of Representatives just this past Monday. That actually happened in the last Congress as well. It's passed with unanimous bipartisan support in the House in 2 Congresses now. And so on the next slide, that makes the ask very easy. We're just saying thank you to the House for supporting this bill. But in the Senate, there's still an opportunity. That's really our next step, is to get this bill through the Senate. And so we're asking for co-sponsorship in that chamber. And on the next slide is just some brief talking points. Again, just kind of what the bill does, what it is. And on the last slide, we have a QR code to take action. But again, I know this is something we're so appreciative of, the support of AAKP, of your constituents and your advocates. We know this is something, again, so important to the Down syndrome community, but so important to the transplant community as a whole. And so we appreciate your support. And if there's questions, or I know we have so many other fantastic panelists here as well.
Tell you what, thank you very much, Anna, and thank you, Charlotte. I think it's fascinating that we had Ray present about the impact of quality-adjusted life years and how antiseptically government in some parts of the world looks at individuals as somehow being less important than another person. And I think the finest retort to that is listening to Charlotte talk about how she's been able to take legislation through the Congress of the most powerful country on the planet and demand greater accessibility and transparency and access, just like any other citizen. You're a fine testament to patient advocacy, Charlotte, and I know that everyone in that room and everyone online salutes you. One of the things on this panel that we've been able to do is to focus on greater opportunities for transplantation and to make certain that discrimination doesn't become a barrier. But the other thing that we're very focused on is the health of transplant recipients and also protections for living organ donors. And right now, what I'd like to do is move to Parker Reynolds. Parker, Charlotte is on immunosuppressive drugs for her heart transplant. I'm on immunosuppressives. Many of the folks that are watching us are on immunosuppressive medications that go with transplants, and it makes us more susceptible to skin cancer. And I want you to talk about the sunscreen legislation. And then I know that we also have Representative Nadler coming in, so I may ask you to hold on your comments in a second. But as a former senior member of the staff of the House of Representatives, I know you appreciate the timing. But why don't you go ahead and start, and Control will tell me when Representative Nadler comes in.
Absolutely. Thank you so much. And again, just to echo my other panelists, thank you to AAKP for putting together this wonderful panel and just for highlighting the importance of advocacy and the role that coalitions play in that process. So again, I'm Parker Reynolds, representing the Public Access to Sunscreens Coalition. The PASS Coalition, for short, is a multi-stakeholder group of public health organizations like AAKP, healthcare providers, sunscreen manufacturers, and concerned citizens that all came together in 2012 to advocate for Americans to have access to the latest sunscreen technology and to address the backlog of sunscreen ingredients that were pending before FDA. So we have worked for years collaboratively with the FDA, HHS, Congress, and other stakeholders and policymakers on public policy issues to advance that mission. As Paul mentioned, this is particularly relevant to this audience because kidney patients who have had transplants or are immunocompromised are particularly at risk. Paul can keep me honest here, but I think those who have had a transplant or are immunocompromised are up to 100 times more susceptible to contracting skin cancer. And more broadly, skin cancer is the most common cancer in the US, with more people diagnosed each year than every other cancer combined, which is a pretty crazy fact and figure. And while diagnosis and treatment of skin cancer in the US continues to rise, it's actually on the decrease in other countries. So now I want to turn to why that is and why we have such risk and prevalence of skin cancer in the US. The last time the FDA approved a new sunscreen active ingredient was before the invention of the iPod. You heard me right, iPod, not iPhone. So we're currently on iPhone 15 or 16, whatever it is, and yet we still have not had any new sunscreen active ingredients introduced since the 1990s. And that's not to say that the sunscreen active ingredients that we have on the market do not work, but it does mean that Americans in the United States currently do not have access to the latest technology. And that is while the rest of the world is 1, 2, even 3 generations ahead of where we are in the United States. And it's not for lack of trying. Since 2002, there have been 8 new sunscreen active ingredients that have been approved around the rest of the world for use, that have been submitted to the FDA for consideration, but are currently stuck within the FDA's regulatory process and have stalled and have ultimately not been brought to market. When we first began advocating for better access to the newest sunscreen technologies in 2012 when the coalition was founded, the FDA pointed to the burdensome and time-consuming nature of the regulatory process as the key problem for preventing new ingredients from coming to market. In 2014, the PASS Coalition advocated for a bill called the Sunscreen Innovation Act. It was legislation that Congress unanimously passed to streamline the approval process for sunscreen active ingredients. The SIA, for short, Sunscreen Innovation Act, was intended to replace this cumbersome notice and comment rulemaking process with a more efficient administrative order process that we now have in order today. However, because of the FDA's implementation of that process, we still do not have any new sunscreen active ingredients that have been brought to market. To put a finer point on it, FDA has required a testing methodology in the consideration of sunscreen active ingredients that was never used for active ingredients in the past, and it has been found to be unworkable for sunscreen manufacturers. On top of that, the FDA currently requires manufacturers to use animal testing, putting the United States at odds with the agreements that companies have made in order to bring their products to market in other markets across the world, like the EU, that requires them to promise not to use animal testing. So that brings us up to speed to where we are today. To solve for this problem and reduce the backlog of sunscreen active ingredients that we currently have, the PASS Coalition has worked hand in glove with the co-chairs of the House Skin Cancer Caucus, which includes Representatives John Joyce, Dave Joyce, Debbie Dingle, and Deborah Ross, bicameral and bipartisan, who recently introduced the Supporting Accessible, Flexible, and Effective Sunscreen Standards Act, Safe Sunscreen Standards Act for short. And yes, ChatGPT did come up with the name. I'll be honest about it. And this is legislation that seeks to amend the Food, Drug, and Cosmetic Act to maintain high safety standards while providing flexibility for evaluating the safety and efficacy of sunscreen active ingredients. So in particular, the bill would allow for the use of real-world evidence, observational studies, and other non-animal testing methodologies to be used when evaluating sunscreen active ingredients. The legislation is, the whole point of it is to ensure that Americans have access to safe and effective sunscreens, but also to align with international standards and foster innovation in the sunscreen development space. This is in particularly a timely effort in light of the upcoming over-the-counter monograph user fee reauthorization. For those who are unfamiliar, this is a 5-year user fee program for over-the-counter drugs, and it's set to expire in September 30 of this year and will have to be reauthorized before that point. So Congress is going to be working through this process of reauthorizing that program for the remainder of the summer. And it is through our partnership with our public health groups like AAKP that the coalition currently has had a lot of success in having that bill be considered for the AMUFA reauthorization. We've had a lot of hopeful conversations and are really confident that advocacy efforts like what AAKP is doing will really help get that bill ultimately passed in both the House and Senate.
Thank you very much, Parker. And again, for those who are watching, the importance of protecting patients once they're transplanted is almost as important sometimes as the opportunity to transplant. Charlotte is a fantastic example of that, and so many of the patients that are there today and across the country watching know this to be true. Parker, a fast question for you. You've come out of the House of Representatives. You spent time there. What is it like when your patient comes in to advocate for something from a professional staff standpoint? Ray has seen this in the Senate also. But in your experience, what's the impact that a patient voice has across the table from an elected leader or from a senior staffer?
I think it is critical. Now be on the other side of the ledger as a lobbyist, I can say something till I am blue in the face, but it holds so much more weight when it comes with a personal story and a localized story for a member of Congress or their staff to be able to really have a face with a bill, and it makes it personal to that member of Congress.
Okay, thank you very much, Parker. And I'd like to thank Ray and Anna, and especially our friend Charlotte for your courage. And now what I'd like to do is go ahead and pass this over to Ed Hickey so he can introduce a special guest who can talk about the efforts being done for living organ donors. Ed, why don't you go ahead?
We have a very special guest with us today. It's my distinct honor to introduce someone who has long stood as a champion for improved kidney patient health, increased organ donation and access to the right medicine at the right time. Congressman Gerald Nadler is not only a distinguished member of the United States House of Representatives, representing New York's 12th District, but he's also a longtime friend and ally to AAKP and to all the people and families impacted by kidney disease. Congressman Nadler has been a steadfast advocate for living organ donors and increased opportunities for organ donation. His leadership and commitment to listening to patient and organ donor concerns have positively impacted national policy. As a champion for the bipartisan 2025 Living Donor Protection Act, he is helping ensure that those who give the gift of life are not penalized by their generosity. Please join me in welcoming Congressman Gerald Nadler as he joins us live from Capitol Hill. Welcome, Congressman Nadler, and I appreciate you taking the time out of your schedule to join us today and have a conversation about the Living Donor Protection Act.
Sure, thank you.
So in regard to the LDPA, this legislation is a rare gem in the current environment in terms of bipartisan support. Can you tell us a little bit of background on the bill and how you came to become a champion for the protection of living organ donors?
Sure, but first off, let me thank you for having me and for this opportunity to speak at this policy summit. 8 or 9 years ago, a member of my staff had a baby born in kidney failure. She donated her kidney to him, but she told me about the roadblocks she faced in making the selfless decision to save her son's life. I originally introduced this bill in the 113th Congress in 2014. The bill does three things. It prevents long-term care disability and life insurance companies from discriminating against living organ donors. It allows organ donors to access family and medical leave to recover from surgeries, and it directs the Department of Health and Human Services to update their materials on live organ donation. I introduced this bill because we must lower roadblocks to organ donation. There are over 100,000 Americans on the organ donation wait list, and 13 people die every day while waiting for a donation. If we had better laws in this, we might have more organs to donate and fewer people would die. Many donors cannot get the time off to recover from donating an organ because their employers consider the procedure elective and not eligible for time off under the Family Medical Leave Act. A quarter of donors have reported problems accessing insurance because of their status as an organ donor, even though organ donors tend to be healthier than the average American. People shouldn't face these roadblocks when trying to save a life by donating an organ. That's why I introduced this bill.
That's wonderful. Can you tell us where, at the end of the last session, the LDP ended up, and was there anything about last year's experience that was different for the bill in terms of stakeholder legislative support?
We ended the last Congress with 225 bipartisan co-sponsors in the House, more than we've ever had before. And remember, 218 is a majority. That strong support was because of the passionate grassroots lobbying from advocates like all of you. Additionally, we gained the support of the insurance industry last year, which is a major step. This led to many more Republicans on the Financial Services Committee supporting the bill. The bill gained so much bipartisan support last Congress that House leadership considered including the bill in an end-of-year package, and the Senate side considered moving the bill in committee. However, we weren't quite able to make it over the finish line last year. We're hopeful that this year is the year we can pass the bill, finally.
Me too. Strategically, how has the approach for advancing the legislation changed this Congress, and is there still bipartisan support for the bill?
Yes, there is bipartisan support. It's easy to get bipartisan support for good legislation that both saves lives and saves money. And that's exactly what this bill does. The Living Donor Protection Act is more bipartisan than ever before. One of our strategy changes is emphasizing just how bipartisan this bill is. In fact, Representative Bacon, a Republican, will lead the bill in the House this Congress. I will also support the bill as the co-lead. On the Senate side, the bill is also led by a bipartisan pair, Senator Cotton and Senator Gillibrand. Many members from both sides of the aisle have confirmed they will support the bill again.
That's wonderful news. And then one final question for you. After this policy summit, AAKP is kicking off a summer campaign called All Kidney Policy is Local, encouraging grassroots AAKP members and allies to visit their local congressional and Senate offices over the summer break to communicate their support for organ donation and kidney care innovations. What message should patients and allies share about the bill to their congressional leaders and senators?
Well, the advice I give is the advice I give to advocates for anything. Talk to the people who represent you in Congress, your senators, your members of the House, and tell them your personal stories about why we need to lower roadblocks to organ donation. When you share your stories with representatives and how the legislation can improve your life, you help build interest and support in the bill. We know that organ donation saves lives, which should be reason enough to support the bill. What many people don't know is that organ donation also saves money. It cuts healthcare costs by as much as 2/3 by eliminating the need for many long-term treatments for chronic illnesses. This bill also has the support of a wide range of stakeholder groups, including, of course, the passionate folks at AAKP. Here's the bottom line. We must lower these roadblocks to organ donation so we can save lives. The Living Donor Protection Act is bipartisan, cost neutral, effective legislation, will save money, and will get the job done.
Thank you, Congressman. We'll certainly carry that message. And thank you for sharing your insights and for your steadfast support of kidney health initiatives and living donors. Your voice today has inspired all of us, advocates, patients, care partners, and fellow policymakers, to continue this vital work. And on behalf of everyone here, thank you for your dedication, your compassion, and your unwavering commitment.
Well, thank you, and hopefully we'll get across the finish line this year.
That's my hope as well. Thank you, Congressman.